Hello everyone, I'm Dr. Randall M. Haas, and I want to welcome you to a discussion of what we do in our office. It's something called nutrition response testing. I'm one of a little over 600 practitioners in the country with my level of certification, and we are doing a form of energy medicine that's getting a lot of sick people well. Let's start off by talking about some of the results of poor health. Just to name a few: obesity, diabetes, high blood pressure, heart disease, cancer, stroke, neuropathy, fibromyalgia, autism, and so many more that many of you are suffering from that we haven't listed here. Here's some rather shocking statistics, at least I think they are. The U.S. ranks 38th in infant mortality. That means there are 37 other countries in the so-called industrialized world who have infants that survive birth for longer periods of time than we do. Stroke is on the rise. It's the second leading cause of death. And even though the U.S. has the finest acute care in the world, we are severely lacking in our treatment of chronic illness. Autism affects 1 in 45 children on average, and the statistics are getting much, much worse. It's now estimated that by the year approximately 2025, I believe, that 1 out of every 2 children are going to wind up with autism. Cancer is the largest single industry in this country, bar none. If you don't believe that, do your own research and you'll find that what I'm telling you is accurate. U.S. citizens spend, and our government, spend more money on health care than any other country in the world, and yet we remain among the sickest. There's something wrong with this picture. Here is just some bar graphs to show you how the incidence of all kinds of diseases are increasing significantly. Prescription drugs. Drugs mask symptoms. They don't cure anything. And if you listen to the TV at all, you'll notice that it seems like almost weekly the drug companies are coming up with new drugs to take care of diseases that nobody ever heard of or knew existed. The average 65-year-old is on, and that number is not correct. We need to update that. But the average 65-year-old is now on 18 different medications, not dosages, but different drugs. For every 5 drugs you are on, there is a 98% chance that you're going to get a brand new problem that you didn't have before you took the first drug. So most of these drugs that people are taking are to counteract the side effects of conditions that they had for the first few drugs. So the body is not chemically deficient. Therefore, why does it make sense to keep putting chemicals into our bodies? So, because drugs don't cure a thing, as we said. Here's just an interesting picture that we took off the internet to show what our bodies look like with all these pills we're taking. If these were nutrients, that would be one thing, but these are poisonous chemicals. What is iatrogenic? This really means illnesses that are physician-induced, not intentionally, but it happens. And iatrogenic disease is one of the leading causes of mortality and morbidity in this country today. Again, not from any evil intent from the people who prescribe these drugs, but it's the result of their training, and this is what we have come to. And iatrogenic problems are the 3rd leading cause of death in the U.S. today. Estimates range up to over 200,000 deaths per year, and that number is considered by many people to be a conservative one. So there are 90,000 chemicals and counting in our air, food, and water. Over 10,000 of these are in our food alone. And sad to say, the chemical companies are adding over 2,500 chemicals to our environment every year. Does anybody in their right mind really think this is healthy for any living thing, human, animals, or plants? GMOs present another risk, and where does most of this come from? It comes from primarily a company called Monsanto, although there are several others, that are modifying our foods, and we have found that this is causing carcinogens, cancer, to develop in rats. It's not a great leap of faith to believe that we're going to eventually be able to prove in the not too distant future that this is also having the same effect on humans. Preservatives, hormones, antibiotics, why should we stay away from these and other food additives? Because they, first of all, they are poisons. The body is not meant to utilize these chemicals. So here's a little picture to illustrate what too many of our grocery store shelves look like today versus what we should be eating. In my office, I always tell my patients the best thing to do when you go into a grocery store is stick to the outer aisles where the fruit and produce is, unless you need to get paper towels and toilet paper. Otherwise, it's a pretty good bet you should stay away from the inner aisles. Toxins in the nervous system. In our office, we check for 5 different categories that we call stressors, one of which is heavy metals, and another is chemicals. We check to see if these things are in the body, because if they are, they need to be removed, and they're removed through natural process. Natural products, it's all painless, it's not very complicated. We're finding all kinds of metals in people. The most common one to find is mercury. Mercury is a tremendously powerful neurotoxin, the most powerful and most plentiful neurotoxin of all the metals. And it's found everywhere in our air, food, water. It's very difficult to get rid of it. Not to mention the fact that it's in the amalgams in our teeth. That's those silver fillings in our mouth that is bound together. The different metals in there are bound together by mercury. They're in cooking utensils. And we also look for chemical poisoning, as I said. Formaldehyde. I know when my children went to buy a crib for their newborn, they went to a special place that makes baby furniture without formaldehyde. The kids chew on this wood, and that's often the first introduction to formaldehyde. It's in mobile homes, it's in carpeting, it's in everywhere. And it shouldn't be utilized any place except as embalming fluid. We've got pesticides. It just goes on and on and on. So here is just a very, very brief picture of the different toxins that we face and the different products that they're in. They're in our household cleaning chemicals under the sink in the bathroom, in the soaps we use, the laundry soap, the dish soap. It's every place. All right, so, and again, as I mentioned, we're doing something really unique and very powerful called nutrition response testing. And besides the 2 categories I've already mentioned, which are chemicals and heavy metals, we're also looking for immune problems, like do you have parasites? And the vast majority of us do, sorry to say. We also look for yeast and fungi and bacteria and viruses. We look for foods that you're allergic to, and believe it or not, a lot of people are eating certain foods that does not cause obvious distress or discomfort, and yet their body does not metabolize it well. We're able to detect these products, foods, through the testing that we do. So we also do something called heart rate variability, and it's really not so much about the heart rate, but it's about the condition of a part of the nervous system called autonomic, and that's divided into two parts. And one part makes certain activity like heartbeat speed up, and the other part makes it slow down. And sometimes that's not functioning as it should. When that's the case, we want to know which one or ones of these different stressors that I mentioned previously are causing that problem. Because until we correct that, the rest of the testing is not going to be valid. We're also testing factive scars, and that's for another discussion, or which we will explain to you if you come in our office to seek our help. Pardon me. We also use a complete supplement regimen that is specific for the individual needs based on the testing that we do. So we never have any two patients alike. That's why we're so excited about the work that we do here, because every patient is different. We never have two conditions exactly the same. So it makes it not only interesting, but challenging and very rewarding, especially after we help people who have been suffering with the same problems for, in many cases, for decades. Okay, so we'd love to have you give us a call. Come in and let us see if we can help you. We're helping people with many, many, many different types of problems, which we've already mentioned. Let me give you my phone number. It's 904 area code 260-1993. I'm Dr. Randall Haas, and this is Breakthrough Healthcare, and we look forward to helping you soon. Phone number again, 904-260-1993.